There's gonna be a new Danny Tanner. Somebody who everybody likes and they want to be around.
That, of course, is Bob Saget on the set of Full House. The actor and comedian died suddenly on January 9th. Certainly a shock to his fans, friends, family. Now, new information coming out of the results of the autopsy. The medical examiner ruling Bob Saget died of blunt head trauma. He was COVID positive. His heart was enlarged. No indication, though, that COVID played a role in his death. His family confirming he died of head trauma. His head injury reminded many of actress Natasha Richardson, who passed away after hitting her head during a skiing accident. That happened in 2009. And our thoughts are certainly with the families here. Want to bring in internist and pediatrician Dr. Frita Fisher. Dr. Frita, good to see you. You're also the author of the book Under Pressure, a guide to controlling high blood pressure. Let's talk about head injuries. You never really know how serious they can be.
You never really know, but it's very important that if you do have a significant trauma, if you hit your head, especially if you have certain symptoms like confusion, if you have nausea, vomiting, and if your family members notice that your behavior is changing, you want to go in and get it evaluated because it's actually more common than we realize.
Some people may think, okay, just slip, there's a little bit of a bump, it hurts a little bit, but I'm fine. And maybe, like in Bob Saget's case, it's the evening and he goes to sleep, which is, of course, something you shouldn't do.
Right. So what happens, especially with the subdural hematoma, which is what he unfortunately had, you have a blow or a trauma. So it could be a fall or it could be something where you hit your head. I had a patient who actually had a garage door to fall on his head. He felt fine, but then weeks later, that's when the symptoms develop. And that's what often happens in the subdural hematoma. You'll have the trauma. Weeks later, you develop the headache, the confusion, the nausea, and vomiting. So you really have to be on the lookout. And people who are over the age of 60 are at higher risks because as we get older, our brains actually shrink. They atrophy. It happens to all of us. And when that happens, the veins that connect the brain to the dura will stretch, which will make it easier for them to break, these bridging veins. Also, if you're a person taking a blood thinner or someone who is suffering with alcoholism, you're at a higher risk. And so you absolutely must beware. But the subdural hematomas are certainly things that can happen after a blunt trauma. And we have to be aware and really pay attention to symptoms. And when in doubt, go to the ER and get evaluated.
Yeah, self-diagnosing. I'm not saying Bob Saget did this, but in other cases, let's say someone played football and they're looking at their eyes if they're dilated. Self-diagnosing may not do it because you could have bleeding in the brain, right, or brain swelling.
Absolutely. And what's interesting about like the football injuries, which is a different type of injury, usually an epidural hematoma, you will get a blow to the head and you may pass out or feel dizzy and confused, but then you feel fine. You have a lucid period, you feel great. And this may be what happened to Natasha Richardson because she did have an epidural hematoma where an ambulance actually went to the place of her injury and the ambulance was sent away. And it's possible, I don't know, that she may have had that lucid period where it's like, I'm fine.
Yes.
But then start to decline. And so even if you have the head injury, you pass out, but you feel fine, understand that could still be a telltale sign. So get evaluated.
I do remember that Natasha Richardson did say she seemed okay and said that she felt fine. But again, you do never know, and higher risk the older you are. Dr. Frita, thank you so much. Always good to talk to you.